We are honored to be joined for the first time by Saad Ehtisham, who is the President and Chief Executive Officer over at Atlantic Health, one of our longtime underwriters and healthcare partners. Good to see you, Saad.
Nice to see you, Steve. Thank you for having me.
You got it. And by the way, for those who don't know Atlantic Health, describe the organization, please, Saad.
Yeah, Atlantic Health's been here for 20 plus years. Some of our hospitals you may recognize: Atlantic Health, Morristown Medical Center, Atlantic Health, Overlook Medical Center. We also have our regional hospitals in Chilton Medical Center, and then out on the western side of North Jersey, we have Hackettstown and Newton Medical Center. And we also have a partnership in Freehold with Central State Medical Center. So 24,000 employees, team members. We have 6 hospitals. We got about 1,000 physicians. We got 550 sites of care. We got a big, strong GME, Graduate Medical Education Program. We train about 360 odd residents each year. We got close to a couple of hundred medical students coming through. We have a partnership with Jefferson Medical School as well. So a little bit about Atlantic Health.
How did you come into, and why did you come into healthcare, please?
The journey for me to healthcare started really in Fort Worth. Watching my grandmother go through ovarian cancer surgery. I was 13 at that time. And the way the care was delivered, my brother, older brother, we witnessed that, and we talked to the grandmother, how is all this? How do you feel? And she was just kind of blown away with the personalized care and the compassion that was shown to her. And at that point, we decided, this is a great profession. We want to pursue healthcare. At that point, we both wanted to be physicians. And well, one of us achieved that goal, my older brother. I went a different direction.
What's his specialty?
He's a neurointensivist. He's double boarded.
Wow. Well, thank you for his service and all the clinicians, the physicians and the nurses and all the other folks on the clinical side who make a difference every day. So let me try this with you. I'm curious about this. I often ask people who are in top-level leadership positions what their most significant challenge is. And what is the most significant leadership challenge you face? And is it a healthcare-related challenge or just being a leader in any industry?
I'll give you my perspective. I think the biggest challenge being in this seat, we've all held different leadership seats, but you sit in this seat of running an organization. I think the biggest challenge is making sure that your team knows that you care about them. You got to get that message to them. They got to feel it. The authenticity has to be there, that you care about them, you care about their well-being, and your day is consumed with, how am I making their life better, or am I making their life worse? I think the key success for any leader is if he or she can create an environment where people go home and they're excited to come back, especially on a Sunday. Are they dreading coming back, or are they excited to come back? I think that's the challenge that is before us.
In terms of challenges, Saad, to what degree do you see artificial intelligence, AI, as a significant challenge and/or a threat?
I see that as an opportunity, not a challenge. To me, it's an opportunity. It's because for me, it's not about the shiny object or the new thing. It's not about the headline we're going to get that Atlantic Health is deploying AI. No, it's not about that. We got to know, what problems are we trying to solve? And so if we know what problem we're trying to solve, and there's a solution that happens to be a AI solution, we need to bring that in and then embed that in our workflow. And at the end of the day, we're bullish on AI when it comes to, back office functions, agentic AI. When it comes to ambient AI, which we're about to deploy, we deployed agentic AI for scheduling to reduce friction. We also want to develop AI assistants to work alongside our leaders who can do the mundane work of processing a lot of information and then just giving it to the leader, who will make them scale a little bit faster and bigger and make them more available to be there in front of their team to talk to them and connect with them instead of sitting in front of a computer. So that's where I think the value of AI really is. I am cautious about using AI in making clinical decisions because you got to have a cognitive decision-making person, physician, clinician in between the patient and the technology.
In the effort to keep costs down, particularly when there are so many questions about federal funding and where money is coming from, state funding, federal funding, reimbursement, all of it. How the heck, Saad, do you keep costs down? You're laughing, why? And still do the personal human touch and be as caring for patients and their families as you just described, and I know is so important to you. How the heck?
Yeah, I'm laughing because, it's easy to say, well, what's the biggest component of your expense structure? Well, salaries, wages are going to come up. They're going to be anywhere from 45% to 55, some places 60% off your expense line item, right? Then you got supplies. So it's like, well, that's costing you a lot of money. Should we focus there? I tell you what, your front line is your bottom line. You start focusing there, you've already lost the battle, right? You need to think about how you enable your team to think differently. This is where technology also comes in, right? And part of our iteration is going to be using, Lean Six Sigma and reducing waste within the organization. There's a lot of waste in most organizations. There's duplication that happens within the organization. What do I mean by that? Specialist comes in, cardiologist orders a test. Here's another one, specialist comes in, they order another test. 2 similar tests being done, money going, testing. And so that's where we're going to focus on. We're going to focus on access as well. There's a lot of, can we get the patients when they want to be seen by a clinician in the clinic office, physician office in a timely manner? You're having some chest pain, your wife, my wife nags me every time something happens. She's like, hey, you need to go see a doctor. I don't want to go see a doctor. But she makes me go see a doctor. So I make an appointment and I can't get in a timely fashion. Yes, I'm going somewhere else. And so we got to fix those type of things. So I think for any leader, think about what you're doing and how you're operating and focus on those things. Reduce the friction between the patients, consumers, and us. Take care of your team. If you're having to come to your team at the end of the day, and there's a lot of headlines. I just saw a headline in our own state, in our backyard, 1,000 people, right, the other day being going to be downsized. I just think that's just a wrong direction. Atlantic Health really proud to say during pandemic, when you saw all those headlines of workforce reductions, we did not do any of those.
None.
None, zero. We focus on our culture a lot here, and you can get a lot more done. So my goal is, you talked about AI, my goal is, so let's think about this for a second. They're working at 100% capacity right now. That's causing some burnout too, right? Can we bring technology to support our clinicians where they work at now 90% off their current capacity, not 100%, but produce 150%? I think that's possible. And when you do that, you enable a resilient workforce and you don't have to think about laying anybody off because you're getting more production out of them.
Saad, I cannot thank you enough for joining us. We appreciate it.
Thank you, Steve. I appreciate it. Look forward to the next conversation. Take care.
You got it. Stay with us. We'll be right back.
One-on-One with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by EJI Excellence in Medicine Awards, a New Jersey Health Foundation program. Horizon Blue Cross Blue Shield of New Jersey. The Turrell Fund, a foundation serving children. Rutgers University, Newark. The Burke Foundation. Newark Board of Education. PSEG Foundation. The New Jersey Economic Development Authority. And by the Fidelco Group. Promotional support provided by NJ.com. And by bestofnj.com.
At the Turrell Fund, we know that all New Jersey families deserve access to affordable, high-quality childcare. Early childhood education supports healthy brain development and provides essential support to power the economy, enabling parents to work, businesses to operate, and communities to thrive. The Turrell Fund is proud to be part of Start Strong NJ, a statewide initiative to put affordable, high-quality childcare within reach of all New Jersey families. Learn more at turrellfund.org and startstrongnj.org.